Well, hello and welcome to our webinar today. Today, we're focused on integrating your community health needs assessment into your strategic game plan. I'm Jon Headlee, president of 10 Atoms. We're a healthcare-focused brand and marketing firm, and we really focus on the link between increasing revenue and growing brand leadership. Our webinar series is focused on the person wearing both the and the strategic planner hat, or somebody who just wants to know more about marketing and planning. If you have questions, please use the Q&A feature on the WebEx platform in the bottom right portion of your screen, and we'll have time to answer your questions at the end of our time today. Also, the last slide will have our contact information, so if you would like a copy of this presentation, it'll be available for download, and we'll provide that information to you. Well, I'd like to introduce Ann Lambdin. Ann is Senior Vice President of Healthcare Strategy for Stratasan. She's worked in healthcare for over 25 years in strategic planning and community health assessments. Stratasan provides intelligence to hospitals, healthcare systems, marketers, and physician relation representatives, equipping them to make better choices while maximizing system growth. So Ann will lead off with our objectives we plan to cover today and dive into the details of the CHNA process. Ann?
Thanks, Jon. Hello, everyone. I'm going to cover the objectives of our webinar today. I'm going to give you a refresh on the required components of a community health needs assessment. We're going to talk about the similarities between a CHNA process and a strategic planning process and learn how the information gathered in the assessment of the community, how you can use that in your strategic plan. And since Stratasan has done about 50 community health needs assessments in the last 5 years, I'm also going to tell you sort of the strengths and the weaknesses of the process that we have determined in the last couple of years. And then Jon's going to show how healthcare organizations use a wellness and a brand strategy to improve the health of their population. So what are those required components of a CHNA? Next slide, please. So a lot of hospitals have been doing community health needs assessment as part of their community benefit for a few years, but it actually became a requirement under the Affordable Care Act that all 501c3 hospitals conduct community health needs assessments in order to maintain their tax-exempt status. And the requirement is in effect for the taxable year of each hospital beginning in 2012. So the first thing I would ask, if I were you all, is, well, isn't President-elect Trump going to repeal the ACA very soon in his presidency, and won't this requirement go away? But in the words of Lee Corso, not so fast, my friend. So he won't be able to repeal Obamacare overnight. It will take a while to repeal and replace. And he's already stated that he wants to keep parts of the Affordable Care Act intact, and he's being encouraged to keep the CHNA requirement. So we really won't know, but make sure you pay attention over the next few months with what happens to the CHNA requirement. Now, investor-owned hospitals are exempt, but I will let you know that we're working with a group of investor-owned hospitals that feel the need to do a community health needs assessment. And keep that in mind as I go through the webinar. Why would you do one if you don't have to? So be thinking about that question. And then, although this started back in 2012, the final rules were released on New Year's Eve, 2014. So those folks at the IRS sure know how to party. They issued regulations on New Year's Eve. And here is the Form 990, Schedule H. I encourage you, if you have anything to do with your community health needs assessment, to go to the internet, download the Form 990, Schedule H, because it lets you know what the finance people are going to be filling out. And it really does a great job, this form, of outlining the requirements. So the IRS really tells you what needs to happen. It doesn't tell you how you need to do it, how to implement these requirements. So let's just start at the top. And it says that hospitals are required to conduct a CHNA every 3 years. I will tell you this is interesting because health departments are required to do this in most states every 4 years. So that's the first thing, is try to get on a schedule with your health department, even though that'll be a little difficult. So every 3 years. The next requirement that it talks about, I'm just going to walk down this form, is a definition of the community served by the hospital. So you have to define a service area. We typically select a county because most public health data is available on the county level. So your service area can be one county. It can be as many counties as you serve as a hospital. Just make sure you don't carve out any areas, particularly underserved areas or low-income areas, because that's part of the requirement. You need to look at the demographics, the age, the sex, the race, just the population. Is it growing? Is it declining? You need to look at existing healthcare facilities. We call this the community asset inventory. It's what resources are available in the community to respond to the health needs that you're going to identify in the assessment. Talk about how you obtain data. Did you do a survey? Did you do focus groups? What's the source of the public health data that you use? You have to define the significant health needs of the community. It actually says you have to involve the community in defining those significant health needs. So you need a method of involving the community in that prioritization. You need to look at primary and chronic disease needs and other health issues of the uninsured, low-income, and minority groups. You need to describe the process that you used to identify and prioritize those community health needs and services. And how did you get your community input? And we're going to walk through a process, and I'll give you some options for getting that community input. Information gaps. So if you think of it this way, the homeless population, you may not be able to survey the homeless population. So that may be an information gap in your CHNA process. Did you conduct the community health needs assessment with other hospitals? That's encouraged. If there's more than one hospital in your service area, that's encouraged. Did you involve public health? Actually, in the requirements, they say that you have to involve public health. Again, you have to involve people who represent the broad interests of the community, as well as those who are uninsured, minority, and low income. Another requirement is that the CHNA report be widely available to the public. So how do you do that? Well, it asks for the hospital's URL. So obviously you put it on the hospital's website. If you want to put it on the health department's website, you could put it there and list that hospital, that health department's website URL. You have to have paper copies available at the hospital for inspection or to hand out to people if they come and ask for it. You have to create an implementation strategy to meet those significant needs. So here's what's interesting is you don't have to meet every community health need as a hospital. The requirements actually say you don't have to, but they also say that you have to say which ones you're not going to meet. And hospitals hate this requirement. Every time I tell them, well, you need to list what you're not going to meet and the reasons that you're not going to address these issues. And they just hate it because as hospitals, we want to address every need. But usually it's because of resources, human and monetary. So, for example, if teen pregnancy shows up as one of your top health concerns in your community, the hospital may not be equipped to address that. So you just have to say, we don't have the expertise to address teen pregnancy. We're going to focus on access to care and chronic diseases. So that is a rundown of all the requirements. There is one more, and it may not be on this sheet, but you have to measure the impact of the previous CHNA, which came in at the last minute in the final requirements, and that happens to be the part of the CHNA that hospitals are having the most problem with. It's for two reasons. One, it came in late, the requirement, and then two, it's just really hard. So we'll talk more about that later. So as we move to the next slide, so hospitals have to do a community health needs assessment. But smart CEOs are really seeing how the CHNA links to the strategy of the hospital. Some CEOs are not, and they're doing what I call checking the box, because you saw there were a lot of check boxes on that IRS form. So really, if as a CEO, as your chief marketing, whoever gets assigned this responsibility, don't expend the resources to complete an assessment just to meet the requirement. If you're going to go to all the trouble to assess the health of your community, involve community members, create an implementation plan, and by all means use it to strategically advance the hospital in the eyes of the community and actually improve the health of your community. So this is my letter. Please don't check the box. I'm going to go over the Stratasan CHNA process. It's not rocket science. There are many other processes you can use. I'm just going to tell you what ours are and where hospitals are excelling and where more work needs to be done. The first difference you'll notice probably between the Stratasan CHNA process and perhaps another company's process is the market research analysis, which is stage 1. This is the typical analysis you would do before a strategic planning process. It's more hospital focused. We look at your patient data, market share, and I'll go into each one of these in a little more detail, but stage 2 is what you typically think of when you think of the community health needs assessment and evaluation. It's a lot of secondary research. It's the community asset inventory. The stage 3 is primary research. You can do this a couple of ways, through online surveys or phone calls or interviews or focus groups. Stage 4 is the Community Health Summit, the Community Engagement Summit. This is one of the ways that Stratasan recommends to get community involvement. It also is really great PR for the hospital. You share the information, prioritize the health needs, and brainstorm solutions. And the final report meets that requirement for having a report on your website about your CHNA and your implementation plan. But really use that final report as an opportunity for more PR. Use a lot of pretty pictures from the community, make it visually appealing. Just be another way to promote what the hospital's doing for the community. So let's take each one of these processes, stages, and review the process. So in the market research analysis, like I mentioned, it's very hospital focused. It's looking at the hospital's position in the market. We're going to look at patient data. We're going to geocode that patient data to a rooftop level or a block group level. We're going to look at your inpatient, outpatient, ED, and even physician office data. We're going to make sure your service area is appropriate. We're going to analyze utilization. We're going to look at some top diagnoses that you see in your hospital. So this is when you're starting to see, oh, there is a link between my market research analysis, my strategic planning package, and a CHNA, because you have to define a service area, and you have to look at what are the top issues in my community. We look at the demographics of your service area as well as your psychographics. These are things we look at also in a community health needs assessment. So let me tell you about psychographics for just a second. So you know what demographics are. They're age, sex, race. Psychographics takes that information and layers on behaviors. How do I behave? Well, where do they get this information? We use S3 tapestry segmentation for psychographics, and it layers on behavior data, spending data. How do we spend our money? There's very large databases with credit card swipes and loyalty card swipes, and we take that information and we can tell what kind of health behaviors people are engaging in, what kind of cars they drive, how to communicate with them, which is very helpful both in advancing the hospital and in advancing the health of the community or population health. We look at business and industry. Now, for the market research analysis, we may be looking at that for what kind of insurance people have, what contracts do they have. But in the community health assessment, we also look at this data because, as I like to say, there's 3 places that people are held captive during the week that they're easier to communicate with, and that is work, school, and church. So those are key places that you can impact community health. So we want to know about the top businesses. We want to have the list of churches in our community asset inventory. We want to have the list of schools in our asset inventory. And then the market share piece. We look at market share by zip codes, by service line. We look at in and out migration, what's leaving the service area. And this really gives us insight into access, which can also be used in the community health needs assessment. So that's stage one, really tying it into your strategic plan. Stage two is that secondary research and evaluation. A lot of this is available on the internet if you know where to look. And this is why I was mentioning that, you know, you may want to have a company help you with the assessment piece, because if you're going to add resources for community health improvement, I would add it to the implementation and the measurement part, not the assessment part. The assessment part only happens every 3 years. So use somebody to help you get through this stage 2 and 3 and 4. So what we're looking at here are the health needs and determinants of health in your community. We're looking at socioeconomics, because as you know, socioeconomics is directly linked to health status. So we're going to look at poverty rate. We're going to look at the poverty rate of children. Next is public health data. We're going to look at low birth weight babies. We're going to look at diabetes prevalence. We're going to look at the leading causes of death in a community. We're going to look at access to health care issues. We're going to look at population to primary care physician ratios, hotspot analysis. This is what we can use your patient data for. We can also use state data if it's available to see where are the areas in my county where there is more cancer or more heart disease. One of the requirements is you have to evaluate medically underserved, low-income, and minority populations. So we're going to do that in stage 2. The asset inventory, documenting all healthcare, governmental, and nonprofit groups in the community. And then the hardest part for hospitals has been the evaluation of the impact of actions that were taken since the preceding CHNA. So we'll talk more about that later. So looking further, we're going to talk about what are some of the resources that you can put into this assessment in addition to that publicly available community health data. So this is a county in Texas where we did the community health needs assessment. We're looking at population by census tract. We're looking at growth rate. And we can look at the block group level or census tract level depending on what's appropriate. And it's really interesting to look below the county level because a lot of the public health data is only available by county. So we talk about median household income. We talk about average this or that. But when you look below, you can see, particularly if you look at the map on the right, the median income, and you look to that census tract just east of the hospital, you can see it's a fairly low income census tract compared to the other ones. So right there, you know that census tract may have community health needs that, say, the one just south does not have. You can also look at the map on the left that's a younger census tract population. So you have younger and lower income. If you look at, also you can pick out the older populations within a county. And as we know, older people have different health needs than younger people. So use any resource you can to look below the county level because you cannot treat the whole county the same as you're assessing and as you're implementing strategies. You may have different strategies for different parts of the county. Now, the next slide shows a perfect example of this. And using that psychographic data, that S3 tapestry segmentation, we can look at a lot of health indicators. This one just happens to be heavy cigarette usage. But we can also look at utilization of prescription drugs and crime information at a geography lower than the county. So if we're looking at this for community health improvement, the first thing you notice is everything is based on an index. If you look at the legend, the U.S. is 100, meaning that that's the average U.S. household utilization, smoking 9+ packs of cigarettes per week. Anything above 100 means it's more than the U.S. Anything below 100 means it's less. So if we look at our Kerr County example, they have that one census tract just west of the hospital that is 60 to 113% higher heavy smokers than the average U.S. household. And then there's 3 census tracts that are between 30 and 59% higher than the average. Then you have the yellow that's 1% to 29% above average U.S. heavy smoking. And then you see there's some census tracts where there's less smoking. So if I'm going to impact smoking in my community, one of the places I might start to reach people is in that census tract just west of the hospital. So again, let me reiterate, if you can get below that county level, it's really important you find areas that need extra attention or have some socioeconomic challenges. So the next slide, we're going to talk about county health rankings. It's one of those many resources that are available online that has community health data for CHNA. But unless your health system or hospital has someone dedicated to community benefit or community health improvement, you may not be familiar with them all. So what this does is we take the county that we're looking at, which is Kerr County, and we compare it to all the surrounding counties to see how we compare. And then we highlight the areas that are opportunities for improvement. And also the county health ranking site has some strengths if you want to know what your strengths are. But for our county that we looked at, smoking is a problem, obesity, physical inactivity, and high uninsured. So this gives us some ideas of already some things that we might need to look at in our community health assessment and planning. So the next slide goes into a little more detail about those county health rankings. And it really focuses on health outcomes and health factors. And those are the 2 main rankings that rank within the state. I'm not as concerned about their rankings as I am about the measures. So the measures are more over to the right-hand side. So under health outcomes, there's length of life and quality of life. 2 important things to look at. Under health factors, it looks at 4 measures, categories. Health behaviors, which are those decisions that we make every day. Do we smoke? Do we eat right? Do we exercise? Do we drink too much? Do we take drugs? Do we have unprotected sex? All those decisions. So that's health behaviors, and that's 30%. Then we have clinical care. Do we have enough physicians? Are we doing screenings? Then we have social and economic factors, which is the largest portion of those health factors. And that's what's our income? Are we employed? Are we graduating from high school? And then the physical environment is only 10%, but it's really clean air, clean water, available housing, and commuting patterns. So there's a lot of resources online. That's just one that I wanted to bring your attention to. So on the next slide, we're going to start talking about stage 3. So in the requirements, it says that hospitals have to get community input. Hospitals are doing a really good job on stages 2 and 3, but it doesn't say how we have to get input. So we have about half our customers, maybe not even half, do some telephone or some online surveys of the community. We have some that that do an online survey for their hospital employees and physicians because they live in the community. But all of our customers get input through focus group or groups or interviews with community members. So not only do you need that quantitative information from stage 2, you really need that qualitative information from stage 3. So moving on to stage 4 is community input and engagement. Again, it doesn't say how you have to get this. We like to use the Community Health Summit to bring together members of the community. We've had them as small as 35 people and as big as about 130 people. And you bring in all these people from around the community and you share with them all the data that you found, the interviews, the focus groups, the data, and then you let them prioritize the health issues in the community. So you're meeting a whole lot of the requirements. And here are some pictures of a Community Health Summit. You'll notice in the bottom left-hand corner there's some presentation involved. It's presenting all that data. Then you'll notice in the middle the community is prioritizing those health issues. So, for example, it might be obesity or diabetes. And then the other pictures show how the community meets in tables and they brainstorm. What are some solutions that we as a community can implement? And then the hospital can use that information as part of their implementation plan. So the Community Health Summit is a hugely valuable piece of doing the community health needs assessment moving into the implementation plan. So looking at the next slide, stage 5 is the final report. again, remember from the Form 990, it has to go on your website. So I would use this opportunity to make it pretty, using pretty pictures. This happens to be Peterson Regional. And what this report does is it summarizes the whole process, meeting all of those requirements on that checklist. It includes your implementation plan. And it meets a lot of requirements, but don't forget it's a good communication piece to communicate with your community. So what happens after that stage 5, or while you're doing your implementation plan? So after the assessment portion and the prioritization of the top health issues, hospital has to create an implementation plan. So, for example, Peterson selected the top 3 health needs they were going to address, which was mental health and substance abuse, chronic diseases, and access to health care. And I have to tell you, these are not unlike many of the top priorities of hospitals around the country. And this is the second biggest challenge I think that hospitals are having, is coming up with an implementation plan that's really focused on the community and not as focused on the hospital or growing hospital business. It really needs to be focused on the community. Again, I mentioned the hardest time that hospitals are having is with the evaluation of the impact, because you have to include an evaluation of the impact of the last CHNA. So really it's measurement and monitoring. So how can hospitals do this? So on the CDC website, there's a framework for implementation and evaluation, and this is it. Pretty straightforward steps, but if you work in a hospital, this should look fairly familiar to you if you have worked at all in quality improvement, the plan, do, check, act cycle. So what I recommend is if you're involved in your hospital's implementation and evaluation planning, I would involve some of those people from the clinical quality department. They're really good at measuring and evaluating programs and interventions. So there's a reminder that you have resources within your hospital and health system that you may not normally think about. So please involve those quality people. Now, here's another method of monitoring your goals and measuring impact. I created this from a Excel spreadsheet. So what I did in this example, the hospital selected access to care, obesity, chronic disease, and smoking as the initiatives it was going to work on. So then it would create goals and have measures for each of those goals. So here they had increased access to primary care, decreased obesity, decreased diabetes, et cetera, et cetera. And then what they would do is put in your pre-CHNA score, your measure. So you may put in something from 2010. You may have had your CHNA in 2012, your last one, or 13. So you might put that score in. Then you put in your current score from today, your 2016 CHNA. And then think about a goal. Now, how would you create that goal? Well, one, you'd look at what's the national average or the median. You also might look at what's a benchmark, a best practice. The County Health Rankings has the top 10% in the country. Another thing you might look at is Healthy People 2020. What's that goal? And then you can set your goal. And then every year or however often the data comes out, and the challenge will be finding recent data, because public health data usually has a year or so lag time. But monitor all of those goals and measures that you set in your implementation plan. Just every year, look at how are we doing? What were our interventions? What were the outcomes? Now, sometimes it may not have a number associated with it. Let's say you wanted to do screenings at employers. So you may have, we did 100 screenings. We found, we served 1,000 people. We found 100 people who were pre-diabetic, and we got 99 of those 100 people into primary care physicians who manage their diabetes. So it may not be just numbers all the time. It may be you're measuring your process. So, again, there's ways to do this. There's companies who actually do this. They'll have cute little dashboards, speedometer-like things. But you can do it yourself with an Excel spreadsheet, puts you really in touch with the measures. All this is publicly available. You can find this information. It's just organizing it into a way that you can measure what you're doing. So we've been talking about, since the beginning, the CHNA as a strategic planning tool, but I wanted to be very clear here, what are some ways that you can do this? So listening. So you're going to have a focus group. You're going to have interviews. You're going to perhaps do surveys. Listen beyond the CHNA, because people are going to talk about your customer service. They may talk about your hospital's clinical quality. They may talk about trouble accessing your services. Don't just say, well, that doesn't apply to the CHNA, so I'm not going to pay any attention. Make sure that information gets to who it needs to go to. Listen to your community. Determining health needs is key to product line development. If you find out that your cancer rate is much higher than the state, then that gives you insight into product line development for cancer services. You're going to uncover probably access issues for physician and providers, and that'll give you recruitment strategies for primary care or orthopedics, for your growth strategy. Don't forget, relationship building within the community is key for a CHNA, and that helps with your overall strategy to grow and have a good relationship with your community. Partnering with other resources is key for population health. So if you're a hospital, you need to partner with long-term care. You need to partner with home health, with the health department. All those are requirements, really, of a CHNA. So it really gives you that partnership platform to launch into a population health strategy. If you do a telephone or an online survey for CHNA, don't just limit it to community health questions. You can also ask about access and image questions, image about the hospital, which could be really helpful. If you have somebody on the phone, kill two birds with one stone. The implementation plan of a CHNA should be a category within the facility's overall strategic and implementation plan. They're not two separate things, not related to each other. And it would be great, this is a nice to have, to coordinate the timing of the CHNA prior to the beginning of the facility's strategic planning process. That way you have all this data gathering that's already occurred as you start your strategic planning process. So let's move on to the next slide. So a lot of hospitals use the Studer Group's Pillars of Excellence to organize their strategic plan. And the pillars are service, quality, finance, people, and growth. Now, Sharp Healthcare has added community as a pillar. That would be great if you wanted to add community and put your community health needs assessment and implementation plan under that. Or you could just put it under people, under the Studer pillars. But whatever you do, make sure it's an integrated approach. So looking at another tool that hospitals like to use, the Baldrige criteria. So Baldrige criteria number 3 talks about the customer and the voice of the customer and engaging with customers, that you have to have a process for listening to your patients and customers, that you have to have customer relationship strategies, and you have to have engagement as a strategy. So when I hear all that, I hear community health needs assessment, because it's also a requirement that you have broad representation of the community, that you listen to sub-segments of the population and create a plan. So to me, don't treat your CHNA as something separate. If you're using Baldrige criteria, you can work it right into your Baldrige criteria. And then looking at the next slide, all right, so this is the second worst area that hospitals are focused on, and it's the implementation plan. So remember, you're going to have a goal. I showed you some examples of decreasing obesity by 5%. So here we're looking at obesity, diabetes, and heart disease. So make sure you've had an articulated goal. make sure you have outlined what the impact is going to be on the population. Outline your strategic priorities, and then here's where hospitals are really not following through, the desired outcome. What are the desired outcomes of these strategic priorities? So if you have the strategy of increasing access to healthier food options, one of the desired outcomes would be to increase the number of healthy food outlets, maybe have a convenience store makeover. That's an idea that one of our hospitals we worked with this year had. They're working with convenience stores around their community to have them have healthier foods. So this is a great example. Use this when you're doing your implementation plan, because hospitals are still tending to be a little more hospital-focused as opposed to community-focused. And then on the next slide, I think I've already made the case for why an investor-owned hospital would want to perform a CHNA. But if we look at the next slide, we've worked with about 17 investor-owned hospitals this year, and it's the politically and the socially adept investor-owned hospitals that are performing CHNAs. Why? Because they want to be good community citizens. They know that this information helps them with their strategic planning, and it helps them bond with their community. Next slide. So now I have completed my review and assessment of the CHNA process for the last few years. Now Jon's going to talk about wellness strategies that hospitals have used for branding that have come from their community health needs assessment. Jon.
All right, good deal. Thanks, Leanne. That's a lot of good and solid and thorough information. You know, you've been focused on the requirements and the process, and now I'd like to share the benefits of an inside-out approach that we used with one of our clients that successfully brought their wellness implementation strategy to life. You know, the CHNA is focused on looking at the outside needs of the community, and that's what's required. But here's an example of how you can use the CHNA, again, how you referenced, Leanne, using it beyond for what it's just for what it's intended. So let's look at the benefits of looking from the inside as well. Inside out, including your employees in the implementation plan. And, you know, we need to do this across the board for healthcare workers. They're really good at taking care of patients and their health, but the reality is they're not that great at taking care of themselves. So it creates a real challenge. And to work on the organization from the inside out, there's some very common goals that any employer would benefit from, but particularly in healthcare, looking at making sure that there's reduced absenteeism and focused on productivity. And we're always interested in our culture and morale and how we can ultimately reduce healthcare costs. So all of these benefits contribute to healthier employees and healthier organizations, and that's all really a good thing. So let's talk about Tanner Health. They're a 3-hospital system with about 2,800 employees, serving about 150,000 residents, and they are in a market about 50 miles west of Atlanta. And as you all are probably aware, hospitals, they're typically one of the largest employers in markets. So looking at taking our wellness initiative internally first and how to connect and leverage the internal relationships is key, because the majority of employees work and live in the community, and that's just a great place to start. So when you look at the results of the Tanner CHNA, there were 4 key areas that they were looking at: access to care, their social determinants to health, the chronic disease issues that were identified, and then mental health. So taking those top-level focuses, when we partnered with Tim Adams, the work that we did with Tanner and their strategy and marketing team, we took their CHNA results and really looked at what areas could be best addressed from a marketing communications perspective. We wanted to look at where we could have the most impact, and we identified those that we have listed here. Preventing and reducing tobacco and the same with obesity, how to increase physical activity and nutrition, and then identify ways that we could increase access to and the demand for these high-impact, quality preventative services that were being offered and being further explored from Tanner's perspective for their community. And then looking at the community environment and just beginning to change their perception around the idea of health. Even after we narrowed the top-line results down into what you see here, there was still a lot of information that needed to be shared with the public. So we looked at and developed a creative strategy to look at really some simple key messages that would look and transcend both the internal and the external audiences. So we created the following messages to align all of our initiatives under. And the first one was to be well, eat healthy, and get fit. We wanted to make sure that we aligned each of these key components, and more specifically the programs that were identified in the CHNA implementation strategy with each of these messages. And so as we looked at this, we think it worked and fit really well. Again, focusing on a key message to the community, and these were the areas that we were able to align key initiatives under the area of Be Well. Same with Eat Healthy, looking at ways to improve nutrition within the community. And then physical activity and getting fit. How do we more effectively help the community become more physically active and ultimately more physically fit? And I'll touch on a couple of those examples in a moment. But again, at Tanner, we saw the opportunity to begin with the internal audience first. And so we explored how to best connect these messages with their employees. And as an example, Tanner had access to multiple walking trails that were either on or very near their campus. And whether you have a walking trails or a park nearby, there's typically a great opportunity to utilize areas around your campus. But there were, while they had multiple trails, it really wasn't until we helped them to kind of package a program to give their employees a more tangible kind of product to connect with did they really get traction around this idea. And one of the ways we did that was with some fitness trackers. Through a grant, they were able to provide Fitbits to a large number of their employees, and we kicked that off with one of their contests. And I always talk about how any initiative has to start at the top, an initiative that is going to have significant impact and supported by leadership. And that guy right in the middle of this group, that's the Tanner CEO, Roy Howard. He is involved and he's very supportive. And he is engaged. During a recent challenge, all of the participants logged over 240 million steps and 536,000 active minutes. So through tracking and setting goals and looking at how we can motivate each other, a little friendly competition and some fun prizes, well, that goes a long way. It goes so long that they, as employees in this first initiative and competition, logged more than 192,000 miles. That's walking back and forth across the United States 68 times. So that kind of activity leads to good outcomes. And as they were working with their health coaches and measuring specific details out of their health plans and goals, they had significant improvement with their good cholesterol and a very significant increase in their bad cholesterol. So while Tanner is successfully connected with their internal audience, focusing on wellness, I also want to share for a minute how we connected their wellness message with their external community and how we tied it to their overall brand positioning of advancing health. So we really looked at their brand with a vision, the entire brand, not just about wellness or the direct initiatives out of the community health needs assessment. So we looked at brand at the highest level. How do we focus on advancing health for the entire Tanner organization, from service lines, clinical service lines, to their physicians, just overall awareness of who they are and what they offered, and how that would be communicated in print and outdoor and online and through their website. And then as we got into a service line like wellness, how do we take that to the market, again, in a cohesive way that has a consistent look and feel that is on brand, but yet was addressing their wellness initiatives? And then when we got into some very targeted messaging around disease and condition marketing for specific audiences, again, looking at brand consistency, including all the way down to posters and environmental examples in community locations and farmer markets. Always looking at consistency of their brand. And as we were taking these messages out, we needed one location to drive all audiences to learn more about the details, because quite frankly, there were a lot of details that Tanner had developed that were outstanding, but we wanted to make sure that people had an easy way to learn about them. So we developed a campaign microsite at gethealthylivewell.org. And at the time, again, we reinforced those key messages of be well, eat healthy, and get fit, and really gave people an easy way to have information shared with them with a healthy tip of the week, and then also knowing what events were coming up so that they could get involved. So we supported this wellness initiative with print focused on messaging around quitting smoking and nutrition and the importance of choosing what you eat and how many of each. And then physical activities to address the key metrics to pay attention to as you're looking at your health. And in addition to print, we utilized outdoor and certainly a lot of digital initiatives as well, just for a very high-level brand awareness for the importance of learning more at Get Healthy, Live Well. So this was much more than an advertising campaign. And when we looked at the need for implementation, working with the Tanner employees and others in the community, they developed some outstanding partnerships, and they created an impressive list of programs and educational tactics to really bring their implementation strategy to life. Their Get Healthy, Live Well initiative launched with a diabetes prevention program to help the people of West Georgia avoid getting diabetes. Not treating it, but making sure that they were in a better health state so they didn't get diabetes. So there were 70 participants in the initial program who together lost over 529 pounds collectively, which averaged out to just under 11 pounds per person. So as an example, this is the results tracking that is key that Leanne referenced. So from a nutrition perspective, they developed cooking classes, partnered with local farmers markets, and they introduced a supplemental nutrition assistance program to the community. They launched an app that tied into local restaurants and helping to identify foods that were available and the best way to make decisions for healthier eating when eating out. They explored additional partnerships and created a regional food system collaborative that included farmers and businesses and restaurant owners and chefs. And then they got into the schools with nutrition directors and connected with master gardeners. All of these things were important in connecting with the community. They partnered with Home Depot, where folks from Tanner helped build raised beds for their gardens and gathered supplies. So it was just a great collaborative effort that helped to do more than simply growing food for people, but making sure that the gardens produced more food for needy families and food pantries. And then there was a significant emphasis on young people and promoting the positive nutrition knowledge around fruits and vegetables. So Tanner was able to broaden their reach and engage other organizations around this community effort by aligning with garden clubs and 4-H groups and schools and faith-based groups, all to really get buy-in beyond just those at the hospital, but really leveraged the community as a whole. When it came time to activity and getting fit, they created a weight loss challenge that was promoted to the community. giving folks the opportunity and challenging them and each other to log their exercise and keep a food diary and track and really connect with people to encourage and share ways to be more active. And their weight loss challenges they've done for the last 4 years. The first one, over 200 participants, more than 2,400 pounds, got good input and support by local businesses, and had over 500 people attending their exercise and nutrition classes. Again, measuring results and tracking activities. And I think one of the most exciting things that they did when you look at the future and think about prevention and healthier lives is they really took programs in to connect with kids. And they trained first grade teachers around their Take 10 program, focusing on 10-minute bursts of activity. Over 3,000 students were trained by the teachers on how to get an additional 30 minutes of physical activity in their day. And they designed a play around nutrition, taking that to kindergartners and through third graders and reaching 4,000 students just in a fun way at their level on beginning to understand how to understand the importance of health and wellness and getting fit and staying healthy. So Tanner has done an amazing job of integrating the results of their community health needs assessment into some very actionable implementation initiatives that are making a big impact on their community. So let's take a look just real quickly at another example of how the community hospital has been integrating their commitment to their market with an overall brand strategy. Leanne shared a couple of examples of Peterson Health, and they're a 124-bed hospital with a little over 900 employees located about 65 miles west of San Antonio, Texas. We worked with them to take their brand and messaging to a new level, and as we began to get to know their team and the community, we quickly uncovered the strength of their community commitment. And we created a very integrated brand positioning to engage with their community into their brand and into the importance of the future. And that was focused around the brand positioning of elevating health. And just like at Tanner, Peterson started internally first and led by Pat Murray, their CEO, communicating to the employees the importance of elevating health inside their organization and out in the community. It was supported with environmental graphics for reinforcement, and they looked to engage their staff and associates from an internal perspective, but as well as residents in the community. Wanted to reinforce this message to patients and staff and their families when we visited campus. I'm sure most of you are using standing banners as an effective way to continue messaging both on campus and out in the community with community health events and that type of opportunity to take your brand in a creative and quality way. They leveraged their brand graphic elements on the front of the hospital and made a permanent commitment referencing that. And then we helped them create a information sheet for employees to help them understand the what and how, but most importantly, the why. Why is this important to our organization, to you as an individual, and to our community? And then in a website and a microsite, we took the key messages to multiple audiences of lifting spirits and advancing medicine, empowering patients, improving outcomes, and raising families. And each of those messages had an opportunity to really bring this to life. And we utilized print to introduce the messages of growth and how the hospital is expanding to meet the needs of their community, and focused on partnerships, connecting with families and how they take care of each other and how together we can make a difference in the community, both as a healthcare organization and as members of our community. And that was supported with outdoor as a reinforced, as a complementary medium. And then we helped them to expand their digital presence, working to promote specific programs and events that are tied directly to their CHNA. So yes, they launched the brand, but there were also specific elements out of product line and service line marketing that was focused on specific events that were tied directly to the needs that were identified in their CHNA. And we focused on men because they're an important group around multiple platforms of messaging. And we identified through the community needs how we can take a message of support, in this case around cancer support to their hospice services and dementia support, another example of ways that they were having a positive impact in the community. And then we certainly don't want to forget women in that important audience. They had events specific to women's health and wellness needs, and again, creating opportunities to connect back to the needs. And if you remember, Leanne mentioned on one of those maps the high smoking rates. Well, this is a direct connection to the 7-week course that Peterson developed for smoking cessation. So there's a lot of ways that they've consistently connected their brand and are providing community classes and support to their organization and the community. So as we wrap up quickly here, there's just 4 messages that I would leave with you based upon all the information that we've shared. And that's 1, to be prepared. Leanne gave you lots of details, so understand and know the required components of the CHNA. And then be smart. Align your strategic planning with the process, and it will ultimately save you time and resources. And then be a leader. Develop compelling messages that will educate and inform your community about the services offered from your organization. I'm sure there's lots of others that you will partner with, but through this process, you want to make sure that you are growing and elevating your brand. And then lastly, be accountable. Building measurements into your planning so you can celebrate your successes. And I know with the efforts that all of our clients are doing and the connection that they're making with the community, there are lots of great things happening, and we have to celebrate those, because in the world of healthcare marketing and communications, we can get overwhelmed many times about what we're not getting done, and accountability process will help you measure and monitor your progress. So wanted to take an opportunity to answer any questions that were provided, and it looks like we have one. Leanne, this looks like a question for you. The question is, much of the public health data is a couple of years old now. So how should I use this information in the CHNA process or in the metric measuring process?
Great question. One thing is trend the information. Trend it every chance you get. That way you may not need to know your exact number. You just need to know, am I going in the right direction? And eventually the numbers will let you know whether or not your implementation strategies were correct. Another thing, too, is don't forget to use your internal data as much as possible, just seeing what kind of patients you're getting. So that would be my recommendation.
All right, good deal. Well, listen, I believe our time today is wrapping up here. So if you all would like to have a further conversation and dive into any of the information that we've shared a little deeper, on the screen is our contact information. We'd welcome the opportunity to connect with you. And again, this webinar will be available via download. So if you want to email myself or Leanne, we'll be happy to send you the link. So we appreciate your time today, and have a great day. Thank you.
Thank you.